Hi, I'm Dr. Hayley Brown, and I'm a board certified plastic surgeon who specializes in cosmetic surgery of the face, breast, and body. I've always had a goal of being a plastic surgeon. I grew up in Scottsdale, Arizona, in a family of physicians, and I've always been very artistic and very creative while loving the math and sciences. When I was younger, I had the opportunity to spend a summer in a plastic surgeon's office, and it was from that point on that I decided and I knew that I was going to be a plastic surgeon.
I'm Dr. Steve Brown. I'm a board certified practicing anesthesiologist. I've been practicing anesthesia since 1989. I've done everything from trauma anesthesia, a lot of OB anesthesia, all the way to neuroanesthesia, and now I exclusively do plastic surgery, anesthesia for plastic surgery, and really exclusively for Dr. Hayley Brown.
So together, Steve and I work as a team at Desert Hills Plastic Surgery Center in Las Vegas. Steve and I first met in the 90s, and I was doing my general surgery residency in Phoenix. And we met at a party through a mutual friend, and ever since then, we started seeing each other at the hospital regularly and doing shifts together and doing trauma call together. We moved to Las Vegas in 2000, and the reason we settled here is because the St. Rose Hospital Sienna campus was just being built, and they needed a plastic surgeon in this area to service both this campus and also the DeLima campus in Henderson. And there was a need for a plastic surgeon in this fast-growing community. So we came out here and settled here, and I spent 5 years working in the hospital. I was on call every day, and during that busy time, I also established a very busy cosmetic surgery practice, which is my passion and I always wanted to do, and that's what I currently do and currently focus on. So the best thing about working with my husband is that our patients are able to consult with their anesthesiologist before surgery, as well as after if needed. And there's just a level of comfort that I have when I'm operating, knowing that the anesthesiologist is board certified and well trained with a tremendous amount of experience, and knowing that I don't have to worry about my patient, that they're being taken care of and that they're safe. So for me, it's peace of mind, and it really sets us apart from other practices. Ordinarily, if a patient has surgery, they don't know who their anesthesiologist is ahead of time, and oftentimes the surgeon doesn't. Basically, the anesthesiologist doing the case that day shows up in the morning and introduces themselves. So you don't know the level of experience or the training that anesthesiologist has. So for us, we get to discuss patient cases ahead of time and discuss the best treatment options for them. How are we going to manage their post-op nausea? How are we going to manage their post-op discomfort? And it's just a different level of patient care and patient safety that you won't find anywhere else.
Yeah, it's really a unique situation. Preoperatively, intraoperatively, and postoperatively. Preoperatively, Dr. Brown had mentioned that, we get to discuss the patients beforehand if there's any issues such as nausea, problems, pain, things along the lines of malignant hyperthermia or other issues under anesthesia. We discuss those. Patient, even just a nervous patient, I get the heads up and I get to call them, a week or two before, discuss, what makes them nervous and make them feel a lot better at ease. So that's kind of unique there. Intraoperatively, it's also really nice because I really only work with Dr. Brown in the OR. And really, when we do different procedures, there's different positions, whether we flip them upside down, it's called prone, or sitting up positions, table up, table down. All this stuff is very unique to the plastic surgeon, and every plastic surgeon does it a different way. I've worked with Dr. Hayley Brown so many years now, she doesn't even have to ask me. Table's in position where she needs to be in, makes her very efficient, makes it very safe for the patient. We do the same thing every time. It's not a different anesthesiologist coming in trying to figure out how to position the patient, how to protect their different parts of their body, what have you. So that's unique in that situation. And then postoperatively, which is also extremely important, I'm also there with Dr. Brown, and if there's any issues, and usually it's things like nausea would be probably the most common thing, but also pain, things along those lines. We discuss it amongst ourselves at home.
The most rewarding part about being a plastic surgeon is getting to know patients and simply being part of their whole plastic surgery experience. It's amazing to see the positive life changes that occur after someone undergoes a cosmetic surgery procedure, and it affects every part of their life. So that's what probably brings me the most joy, is just watching that sort of transformation and how it just helps and improves someone's quality of life so much. And Steve and I get to know our patients very well. We love the whole personable aspect of what we do, and we're the type of doctors that are very hands-on, and we provide one-on-one care. We aren't doctors that delegate, and I love to do everything myself. I love to do my injectables. I love to do all my post-op care, and in that way I get to really experience what the patient's going through, and I get to know them very well. And many of our patients have really become our best friends, and we've met so many people just through the practice, just socially. So the patients, they come back and visit us time and time again. We all age together, so they come back for more procedures, and they refer friends and colleagues and sons and daughters to our practice, and they'll stop by. Even today, Marilyn came by, and she didn't even have an appointment. She just wanted to hang out for a few hours and see how we were doing. So that happens all the time. It's a really special thing that we have here. It's almost like a family that we have. So
yeah, I'm at the office a lot doing other stuff besides patient care, whether it's computer work or paperwork or just trying to make things run a little bit smoother. But every time I'm in the hallways, it's kind of fun because I see patients from years ago, and I may not remember the names, but I'm really good at faces. And it's just nice to have patients come up to me and go, "Hey, how's it going, Dr. Brown?" Or Steve, a lot of them call me now. And it's kind of a special thing. I mean, doing anesthesia in the city, really, I never see anybody ever again. And here I get to see, the relationships continue, whether it's just passing by in the hallway or back in the OR years later. It's kind of a nice situation to be in.
Yeah, we feel just very fortunate to love what we do and to be able to work together. And we love living in Las Vegas. We're very rooted in the community now. We've been raising 4 children here, and we love to contribute and just be available. And Desert Hills Plastic Surgery Center is really unique in that we're really the only husband and wife anesthesiologist plastic surgery team that you will find in this city. So it's special.
Special, unique, and something different.